We want to turn now to the global pandemic of COVID-19 and Canadian prisons. In Ontario, an inmate with health problems is being released early today after a court found he's vulnerable to catching COVID-19 in prison. Ontario is also seeing its biggest outbreak of COVID-19 so far in another facility in Brampton. Joining me now is Lee Chappelle, who spent more than 20 years in the Canadian correctional system and is now the president of Canadian Prison Consulting. Lee, thank you so much for talking to us. Now, you talk to inmates in both federal and provincial facilities. What are they telling you?
Well, Ben, I have to say that there's a lot of, clearly the stress is elevated at this point. The majority of our institutions Canada-wide are on lockdown schedules. There's limited visiting, limited phone calls, tight quarters. There's a great deal of concern. When newcomers come in, they're not welcomed. There's a fear that the disease may come in with them or the virus. So it's fairly high stress times right now.
Why do you want to see more cases like this inmate Derrick Snow's reviewed?
Well, I think, Ben, it's the right decision. Mr. Snow was not condemned to the potential of a death sentence. His release is one that protects public safety with a structured release and supervision. The Correctional Service of Canada is using the electronic monitoring system. Mr. Snow had 4 months remaining until his mandatory release date, his statutory release date, and was to be released in July regardless. He's suffering from cancer. He's certainly at a high-risk group. And the Correctional Service of Canada has displayed that they do possess the power and the ability to implement under current legislation what's called the temporary absence release. So this is not an open-ended thing. If COVID improves, hopefully, and dissipates, then he'll be returned to custody. If not, he'll remain till his release date in July under house arrest, stay-at-home order with an electronic monitoring device.
Lee, 60 inmates at the Ontario Correctional Institute in Brampton now have COVID-19. Talk to me about how an outbreak like that could have a domino effect on other services.
Well, certainly when you're looking at a community and Brampton or wherever it's located, the healthcare infrastructure is going to be affected by something as big of an outbreak as that. And similar to elderly care homes, but these are big. Fortunately, OCI has a inmate count of about 200 at the moment, but we have institutions that hold upwards of 1,300. And if that were to occur, that would put a lot of strain on the community within the area, people coming and going daily, and also our healthcare system.
All right, Lee, we're going to have to leave it there, but really, we appreciate your insights. Thanks so much.
Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.